here today kicking off our ET3 partnership with Chesterfield County Fire. ET3 means Emergency Triage, Treat, and Transport. That really incentivizes the ability for EMS agencies to deliver alternative destinations from the emergency department to a patient who calls 911.
We're here to train our field providers, a small subset to run a pilot program to roll out the virtual ED. It's a partnership with the Cleveland Clinic as part of our ET3 project, which really authorizes other opportunities in going to emergency department after calling 911.
Chesterfield Fire and EMS is one of only 6 agencies in the Commonwealth of Virginia to have been selected to participate in this program. Furthermore, we're one of only about 205 agencies across the country that got selected to participate in this program, and they represent about 36 states, including the District of Columbia.
So we're going to walk through next some results today.
There's a working group that we had the opportunity to speak with this morning, go through how we ended up where we are at the Cleveland Clinic Virtual Emergency Medicine Program, our experiences to date, what we offer, but additionally got to just answer a ton of their questions, it's a really engaged group, and again, just really reinforce the excitement that we have to work with Chesterfield County. The remainder of the day is going to be additional training and education for that working group and those medics that are going to be using this out in the field.
When we rolled out ET3 in the development process, we had a work group. We also have another group of seasoned paramedics that we call our field training officers. They're the ones that train new providers. We bring in these 2 groups to roll out the pilot program to really fine-tune the processes to making sure that this thing works for the citizens and residents of Chesterfield County.
We are eager and couldn't be more excited to start with Chesterfield County. Being able to partner with them, they're very innovative, have really proven to see far beyond the value of what the initial starting point of this is into a few years from now. And we'll be actually the providers that they'll be pulling up on screen if a patient calls 911 and qualifies for a treatment intervention via telehealth.
ET3 encompasses multiple different facets, including transport of patients to an urgent care or some other type of alternative destination other than an emergency department. Our job is to actually bring the physician, board-certified emergency medicine physician, to the patient on the scene. And we do that via telehealth.
When you call 911, an ambulance is going to get dispatched. We're going to get there, we'll do an evaluation, and if you meet certain lower acuity call types, like you're not having a stroke, not having a heart attack, you're not getting a major accident, we'll be able to call a virtual ED where you're going to see the same emergency physician that you would if we brought you to a physical hospital.
And through the collaboration and teamwork of our paramedics and the doctor, the treating physician, our hope is to be able to resolve that person's symptoms and leave them in place in their house and avoid them an unnecessary trip and the unnecessary expenses that maybe come along with the downstream cost of being treated in an emergency department.
The patients, first off, they just absolutely love it. When we actually call back a fair amount of our patients, and we've had nothing but great response from them. They're amazed that they called 911, thought they'd be going to the ED, sometimes waiting an hour or longer to actually see a physician. Instead, they get one in real time and they get their needs met immediately. So it's a huge patient satisfaction driver.
It'll be a much more patient-centric experience where we bring everything to the patient. It's going to be a much lower cost because emergency departments tend to be a much more expensive place to get care and much faster. It won't be a wait to see a doctor that's going to be very significant. It'll be maybe a 2 or 3 minute wait. There won't be, I got to drive to the emergency department and how am I going to get home after I've been transported? None of that exists. You'll be at your home and we're going to do the services right then and there in your living room.
We're able to provide the right care for the right patient in the right environment and navigate them to the right follow-up care. Chesterfield now brings the ED to your house as opposed to you having to go to the ED to see a doctor.
By being able to bring definitive care straight to the patient without any kind of sacrifice in quality and decrease that return to service time, then it's a win-win for the county because now they have more units that are in service and they're still delivering that high quality care that that patient has come to expect.
The Cleveland Clinic was a natural partner. By their clinic model, they've always embraced this patient-centric model. They have the same core values as Chesterfield County. So it was a natural partnership.
If we're able to partner two world-class organizations like the Cleveland Clinic and Chesterfield County, it's only going to serve the needs of the citizens of Chesterfield County much better. We're excited. That's going to be a fantastic partnership.